Now, it seems as though the lessons you've learned or the experience you have sort of, and I think in our earlier discussion, you talked about even some of your challenges that you've had. And can you share perhaps about how it's helping you as you're dealing with this yourself now, and how what you steps you're taking to sort of better prepare yourself for the end
But
goal, if you will?
yeah, I don't know. Yeah, I'm a little late to preparing for the end. I I think that what I'm doing to it is even more advocating for myself because as I get older, the conditions I struggle with, which is a form of arthritis, it's a degenerative disease. So some, like I said, I've had 7 spine surgeries. I've had several joint replacements, and I have to very carefully consider each one, even when specialists are saying this is what you need to do. I have found that they are incorrect. I have to really listen and think, not give myself over. I mean, I had this shoulder replacement, but I was feeling these terrible pains into my fingers, which the shoulder surgeon said, "Oh, that can't. It has nothing to do with your shoulder. But let you get a test to see why you have a problem in your fingers." And they gave me a diagnosis, and I said, "I don't think that's right. I might have that condition, but I don't think that's what's causing my pain." Because I had read about the pain that I was getting in my fingers. So I went back to the shoulder surgeon. I said, "They're not right. They're wrong." And he said, "Okay, go to this neurologist. They'll do the same nerve conduction test." I went to the other neurologist and he said, "Well, yeah, you do have some of that condition," they said, "but I found a lesion on your ulnar nerve, which I could see would be causing the pain in your fingers."
Oh, really? Okay.
So I wound up having the surgery to remove the lesion, and then I was able to have a successful shoulder replacement. So,
Wow.
but had I listened to the first neurologist, I would have had an operation that wasn't going to fix my problem.
Right.
Like, so I've hurt my knee, and I go and they said, "Oh, we took a picture. You have a torn meniscus." I said, "That meniscus was torn like 15 years ago. I don't
Okay.
think that's what's causing my knee problem."
Okay.
And again, I got to fight with them because they're like, "But that's what we see." I've been through situations where I have to very politely say, "Okay, thank you," and then move on and try another doctor.
Yeah, so what I'm hearing is that you really have to be informed about this, your own health, the symptoms that you're experiencing, and then also articulate even to the point where you have to argue, right?
Yeah, I mean, like that thing they said was in meniscus. As it turned out, I had a giant cyst on the back of my knee. I had a Baker cyst, they call it, and I had to get the cyst drained. Okay,
Wow.
so I'm like, they were sending me to go through rehab for something that on my knee, and every time I would go to rehab, it would hurt more because it was a cyst that they needed to drain. I'm like, you have to at some point say, "Wait a minute, what are the words you're saying? Let me write this down. Let me look this up." And I hate the thought that you have to know so much more. But again, the system is not. It's a reactionary system we have in this country. There's no preventative care that anybody's really advocating. Everything you hurt yourself, you try to figure out what it is, and then patch up. You come back next time you hurt yourself or get sick. But at some point, you have to know your body. You have to try to take your own fitness on as your own, so that when you go and talk to a doctor or you have an injury, you're not at their mercy. Because I just think that in my case, I would have been set back by doctors just using maybe a protocol they're more comfortable with or stating the obvious or whatever. I'm not trying to badmouth doctors, but I'll leave you with this one thought that what they call the medical student that gets a D+ on his final exam.
No, what's that?
They call him doctor. Okay, they call him doctor the same as the guy who got an A+.
Okay.
So there's doctors of all levels and skills.
Right.
Is what I'm saying. They're not omnipotent. They're not. I think they're human, and people need to take responsibility for their care and not, especially if they're not getting results. I mean, I've heard more people say, "Oh, I go to the doctor, he tells me to do this, and the thing still hurts me. Thing still hurts me." I'm like, you gotta go to a different doctor. If they can't figure out why, and then give you a way to get rid of whatever it is, I mean, then the doctor's not diagnosing you correctly. Please, there's no need to be just plagued by the symptoms that don't go. Okay, and now for the younger people, young, whatever you call them, whatever came after baby boomers,
Gen X.
Gen X. Yeah. I mean, they are able to have things so available to them that were very new in my generation, and totally foreign in a lot of ways to my parents' generation. So I was always lucky. I always had good health insurance because I worked for a big company, and then when I went on Medicare, I was like so thankful. I think it's one the best part of growing old is knowing that I have Medicare and Social Security. And I have been very careful to not get sucked in by any of these Medicare Advantage plans. The cost of my health care, I remember I've had a lot of surgery since even turning 65 because of the spine degenerative condition I have.
Uh-huh.
But with traditional Medicare and a supplemental, everything's been covered to the penny.
Okay. Just real quick. So you do have a supplemental, because I've heard that that's been really helpful as well.
Well, yeah, because Medicare pays 80% of what they approve. So if you were an approved doctor, if you're approved hospital with a surgery, whatever, they will pay 80%. That's Medicare.
Okay. And
so you're left to pay 20% no matter what. You're left. So this is traditional Medicare. So, I mean, if you're really healthy, it's not that bad, okay? I remember having a job way back then, and the company paid 80%. You had to pay 20%. When you're young, you hardly go to the doctor. But then you have to buy a supplemental because the 20% could be a big ticket if you need a big operation.
Right.
Okay?
Right.
So I saw this happen with my mom and dad. I learned everything I knew about Medicare and supplementals versus Advantage plans all through my caring for my mother. I had learned it before I needed to learn it for myself. So I already knew what to stay with Medicare no matter what.
Okay.
And even if and buy a good supplemental.
Got it.
Because at the end of the day, unless you're just one of these rare people that have no conditions and you're going to need it. And usually when you need it is when you can least afford it. So I find it to be very important to stay with the original Medicare and a supplemental.
So earlier you talked about there are affordable in terms of arranging for power of attorney and will, and the AARP offers, you said they have discount attorneys and law programs.
Online you could put your zip code in. I know I've found leads on accountants, attorneys through AARP, and I think, and then you get, for a very low fee, if it's a very simple will, I mean, there's some websites that have been around longer than others, like LegalZoom.
Right.
You download the form, and I don't know if they get it certified or if you have to get, I'm not sure, but I know that there's ways to get it done very inexpensively, and then there's other ways. But even recently, I found that the hospital, like as far as like medical representative and those, the hospital will help you put something together if there's time, and then you just have to get it notarized. And usually you can find a notary like at the library, I guess, or post office.
Or maybe the hospitals have a notary. I may have it as well. Or the banks. Yeah.
I think so.
Yes.
But when I was going in for my shoulder surgery, I was given a pre-check-in packet, and there was quite a lengthy document that I could fill out as assigning somebody health representative, and then I would have had to get notarized. So they were helpful. I mean, that was free, just the price of the notary.
Yes. Yeah.
So I think looking on different websites, I'm sure that there are ways. I mean, I'm up to date, but there's ways to get it done very simply, especially if you don't have complicated family or big assets.
Yeah, before we started this discussion for the podcast, you brought up a very interesting point about shopping around for healthcare and which one to choose. What has been your experience around that, right? Because I know that once you sign up for Medicare and you're eligible for that and you enroll in Medicare, then what is that like to find the type of health insurance and companies to choose? And can you share about that?
Well, as a senior, I mean, you'll find that I shouldn't say that because I guess it also depends on where you live. But the first thing you do, if you want to make an appointment at a doctor these days, you can't really even start the process till they ask you what kind of insurance you have. So the doctor's office is screening you from the beginning to see if they take Medicare, they take Aetna, whatever insurance you're using. I'm assuming this is more targeted towards senior people. So
Yes, yeah.
but there are doctors that do not take Medicare.
Okay.
Not all doctors take Medicare. You have to ask, and not all doctors will submit to Medicare. Some doctors will make you pay and make you file the claim.
Okay.
I don't deal with those doctors.
Okay.
Okay. It's called taking assignment and not taking assignment. And do that to seniors to say you have to do your own bookkeeping and you have to mail this. I just think that's horrible. So anyway, so shopping around that part of it, making sure they take your insurance, and then I have no problem, after I seen a doctor or maybe I've been even with them for a while and I no longer feel that they have a grasp on my best way to treat whatever my condition is, I'll just look for another doctor. I think people get this false sense of loyalty towards their doctor. At a certain point, they should ask themselves, is this serving me best? Maybe this doctor isn't an elder specialist, or maybe my sciatica is so bad, I really going to my doctor, but I need to go to a neurologist. I'm just saying that people need to shop around, find the professionals that will specialize in what they're looking for.
I want to just go back a bit and just for my own knowledge. So, say I sign up for Medicare. So, Medicare it's insurance, its own insurance, or do I have to then select?
Medicare is the only government-run insurance.
Okay.
It's run by the U.S. government.
Okay.
It's Medicare is socialized medicine disguised as the best thing that could happen to seniors.
Okay.
But it is government run, as opposed to a Medicare Advantage plan that is run by an insurance company.
Okay, that's a difference.
When they want to sell you a Medicare Advantage plan, it's Aetna or Blue Cross.
Okay.
Some company, they want to make money off you. So they're going to tease you with all sorts of this and that, and maybe you'll get lucky. Medicare is the government run plan.
Okay.
It by mandate has to provide, they have to be more transparent. They have to be more standardized. More doctors take basic Medicare than they do your particular Advantage plan.
Okay.
Because your particular Advantage plan, you have to really do your legwork to make sure you can find a doctor in your area, a doctor that you're comfortable with. Some Advantage plans have bigger areas they represent than others.
Okay.
But Advantage plans are an advantage to the stockholder.
Got it.
Not the patient, because it's Advantage plans are like traded on the stock market, But there are these companies, Cigna, and all the big ones have Medicare Advantage plans now.
Okay.
They're for profit, but not Medicare.
Okay, so that was the distinction that I needed to understand. Okay, so
a lot of people don't understand it because they call it Medicare Part C. You know what Medicare Part C is? It means you've given up your right to Medicare to basic Medicare, because it's hard to go back to Medicare, the government one, once you've been on these commercial plans. They don't automatically bring you back at the rate. They start fooling around with the rate. It's very, very important not for a senior, if they're going to consider going off regular Medicare to an Advantage plan, I would say don't do it. Unless your health is so good, it's so good that you're willing to gamble.
Okay.
Because two completely different ways to take care of yourself.
And then my follow-up question is, can you go back? You say I sign up for a Medicare Advantage plan, and I say I no longer want that. I'm going to go back to the basic Medicare. Can you go back?
You may. You probably could go back, but you could be penalized.
Okay.
With a higher rate.
Okay. All right. So this is,
if you're going to go in, you can't go in and out and expect to stay at the same rate. That's what I read. That's what I know. That the reason why people, and it's even in like the enrollment books and stuff, they caution you that if you leave Medicare, it's called A and B. Okay, Medicare Part A is for when you go to the doctor. Medicare Part B is when you're in the hospital.
Okay.
Medicare Part C is supposedly A and B together, and maybe Part D, which is a separate drug plan. Okay.
Okay.
Because neither A nor B cover your drugs.
Okay.
Well, in the hospital, B covers your drugs. But your prescription drugs, because when they were able to pass Medicare in the 60s, they wouldn't let, because the drug companies were so powerful, they wouldn't let them give benefits to seniors with prescription drugs. Okay, they were able to get Medicare through for just hospitals and medical visits, but you were still paying retail for your drugs. And then they figured, people were like going broke, and the drug companies are making all the money. So then they started introducing this Part D. So you could have Medicare A and B, but then you need a D. You need a drug plan. So that's what I have. Now Medicare Advantage came along and said, well, hey, we're Medicare Part C. We'll do everything. We'll do all that for one price.
Got it.
And for that, you're going to have a limited amount of doctors, and you're going to need referrals, because most of those Advantage plans are HMOs. You know what an HMO is versus a PPO?
Yes.
Okay. So Medicare is by design a PPO. Mm-hmm. And Medicare Advantage by design is an HMO.
Yes. Now,
so you know what that is.
Yeah. So what about dental care?
Oh my God. The richest doctors out there now are dentists, because they could charge whatever they want. They just get, like 5,000, 6,000, whatever it is. There's very little good dental insurance out there, and especially for seniors. You could buy, but nothing through some of these Advantage plans will include, I think they're token things, like a exam once a year and maybe a cleaning. But standalone dental plans are sometimes a good idea, but everybody's dental problems are different, so it's hard for me to say. I know my mother and my father both had terrible teeth, invested a ton of money in their teeth. I had dental insurance. I had good dental insurance when I was working, and it still only gave me a maximum benefit of $2,500 a year, which didn't buy a whole lot. So some of even the good dental plans I don't think they really talk to seniors. I think seniors are best off going to their local dental schools. I've been over to Rutgers Dental School in Newark for a particular problem with my jaw. I know people who've gotten whole sets of implants from the dental school. There's, if you're on a limited income, there's some opportunities with getting very reasonably priced, if not free, dental care. But I think that's the one huge pitfall. I don't have any real wisdom for that. Only to say that as you get older, even the best dentists can't stabilize everything, and it can become very expensive.
I can imagine. So you've shared a lot, and I think I've learned a lot through our discussion, and just by hearing your experience and sort of wrap things up. Do you have any last minute advice, suggestions, recommendations for the listeners?
Oh, I would just say that if you're taking care of someone else, then you're a superior human being. And if you're taking care of yourself, be gentle. That's all. Just be kind to yourself. It's hard to know everything, and I've learned so much in hindsight and through some heartache of my own, making wrong decisions or not seeing things the way they really were. But we still have some of the best doctors and best hospitals and best technology. So it's just knowing that you deserve to tap that into that and get that for yourself if you need it.
Brilliant. Thank you very much, Sondra. This is excellent.